Good afternoon, everyone. I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. I'd like to welcome you to a continuation of our Roadmap to a Healthy Reopening series presented in 2020. And this is our 20th webinar on COVID-19 to help inform and be a resource to the community. The series was created in response to questions from businesses and leaders as the pandemic continued to evolve. There will be time at the end of the presentation today to have questions and answers. After the webinar, you will be receiving an email with a survey of the event, as well as a link to the slides and a recording of the webinar. I'd like to thank our presenters and partners today for helping to bring timely information to all of us. I'd like to go ahead and turn this over to Hallie Custer, Vice President of Human Resources at Parkview Health, to start the presentation and introduce today's speakers. Looks like we have a problem with Hallie's mic. We'll get that fixed and continue on in just a second.
Okay. Hello again. Wanted to share that we are in this together, and this is a challenging time for all of us. We get it here at Parkview. Nobody wants to go through this again, but we're going through this again, and we know that COVID has turned our lives, our personal lives, as well as our professional lives upside down. But we are here and we are ready to serve. We are here to serve through our trusted healthcare services, and we are a trusted resource for businesses. We want to be that trusted resource to move through this successfully. But we're also a business just like you, and we are experiencing the similar challenges that you are. We are closely monitoring the COVID-19 situation in our state and in our region, and we are using our healthcare experts' guidance, our internal resources, to help make our business decisions. But we're also partnering with our other community experts to share information and, again, to help us get through this. Next slide. So today we've got a really great panel of experts. We've got a COVID-19 community update from Dr. Matthew Sutter from Allen County Department of Health. We've got COVID-19 vaccination data from Mindy Waldron, again with Allen County Department of Health. We will talk about 1 year later, what works, and the OSHA ETS with our Dr. Nip from our Parkview Occupational Health, as well as Anna Below, our Director of Safety with Parkview Health. We will talk about the law and COVID with Joseph Cohen from Barrett McNagny. Hot topics from an employment law perspective. I know that we've got a lot of questions as well. And then we will, at the end, have a 30-minute time for reserved questions and answers to help us get the information that we need today. Thank you.
Good afternoon, everybody. I'm Matt Sutter. I'm the Allen County Health Commissioner, emergency doctor by training, and just kind of want to walk you through, what we're seeing right now in the community. And the good news is, this is what I'm showing you is actually publicly available. In fact, you can look it up anytime. You might want to, as I do, check it daily, or you might want to check it less often. But if you Google ISDH COVID dashboard, you'll get to this splash page, and then you'll get, what look the most recent day's cases and the positivity rate that's a week average. Continuing down, you'll see the state's color-coded county dashboard. You can see Allen County here is in orange, and I'll show you more on that in a minute. And if you come back down, you'll see kind of useful graphs here that describe cases, describe positivity, continuing on down, bed usage, and then what I'm looking at very closely, hospitalizations. So if you look at these numbers, what you'll see is, first of all, we had this big spike in the fall and the winter, and now we're seeing another big surge in cases. All those things are up. Deaths lag a little bit behind, but perhaps more concerningly, our admissions from a state level are up quite a bit and are still trending up. If you come back up to this color-coded map, you can click on any of the counties. If I click on Allen County here, and I'll confirm in just a second, it'll say it's looking at now Allen County specifics data. You can see that we just announced 159 new cases. We were over 200 on one day last week, but our average is in the 160s right now. Our positivity rate has gone up a lot. That's a measure of what percentage of the tests we do each day are positive. It's a weekly average. 11.6 is a very high number. And if you look again, our positive cases, you see this rapidly rising curve. And down here, you see a rapidly rising curve in terms of admissions. Partly what I do is weekly, I meet with the hospitals to try and validate this and make sure that what we're seeing on the ground actually correlates with what these numbers are telling us. And unfortunately, I can tell you that this is accurate. While the hospitals are not yet in crisis, they are starting up their emergency operations again. And it feels like Groundhog Day because once again, we're doing the things that we did in the fall. So what we know is, Mindy will talk a little bit more about our vaccination rate, but about half our population is vaccinated. That's a relatively low number. We would like to see that number much higher. There is a surge in cases really across the country, but it's more pronounced in the states that have lower vaccination rates. And Indiana, unfortunately, is about middle of the pack when it comes to vaccination rates. So what does this mean? Well, you've probably all heard the Delta variant is our primary variant. Between 80 and 90% of the samples that are sequenced are the Delta type variant. This has several mutations in it. And what we've seen is that it spreads much more easily and more rapidly than previous variants. The vaccines are still effective against it in terms of severe disease. And the vast majority of people admitted to the hospital, between 95 and 99% of what we see are unvaccinated. In addition, it appears that most of the spread is by unvaccinated individuals. Vaccinated people probably can spread too, but a much, much lower rate. So the vaccines are safe, they're still effective. They're not perfect. They don't mean that if you get a shot that you're invulnerable. And I think there's some questions about boosters later. In my mind, that's still in question, but it's an open topic with the exception of people who have significant immune suppression. And those people will be getting a third dose of the Moderna or Pfizer shortly, are eligible for it anyway. So that's my quick community update. Cases are up, hospitalizations are up. This is not where we expected to be in the summer. Most experts predicted that sometime this fall we would have a big surge, and this is much earlier. The two primary drivers of that are thought to be relatively low vaccination rate among the general population, and really the moving away from almost all mitigation techniques like masking, social distancing. So everything's wide open. Everybody's doing the things they did before the pandemic, and that's the way that an infectious virus is spread easily. So I'll go ahead and end this here and move over to Mindy.
Thank you, Dr. Sutter, and thanks for the opportunity to share a little bit about our vaccination data here locally. And then I have peppered a few things in from the region, since I know we do have folks on the line that are not necessarily from Allen County. And this is a lot of information that you can't, or you need to read between the lines on the state's dashboard, and I thought might be of interest. So I'll share some general information and then some other things that we discern locally. So if we look at our vaccination rates in Allen County, and this is as of yesterday, as Dr. Sutter said, we have a population just under 380,000, and we have about 165,821 fully vaccinated as of yesterday. And you can see the counties surrounding Allen and their correlating numbers. For Allen County, though, that is only 52.6% of our eligible population, keeping in mind that those under 12 still are not eligible and have not had the opportunity to be vaccinated. So we would drop into the 40s or so in percentile if we were to factor those folks in. But of those that are eligible, we're just over 50%. And then if we look at the whole of District 3, I've sort of highlighted that so you can kind of get the idea of the Northeast region. And then I've screenshotted one of the maps from the state's dashboard that correlates to percentages. And this is important because we are a region and we do work in different counties, live in different counties, do things in different counties. But I thought I would narrow in on the Northeast. On these maps that I'm going to show you, Oh, goodness. I did not know. You're not seeing my screen. Give me 1 second. Since Dr. Sutter didn't take his full time, I'm sure we're good here. I'll skip ahead here real quick. So our population just under 379, you can see we're at 165. And then the correlating counties around that being at 52.6 for Allen. So looking at the Northeast region, you can see the surrounding counties. And then on these types of maps, you're going to want to be as blue as possible. So the bluer you are on these vaccination maps, the higher the percentage of those that are vaccinated. So we do have one county that is showing in the 25%, several in the 39%, several in 40%, and then Allen County in 52%. We've still got a lot of work to do in that region. And if we're looking at age trends, and this is by age group and individuals for all of Allen County vaccinations that have been done, we have about 91,000 or a little more of those that are 50 years and older vaccinated, and about 74,000 of those that are 12 to 49. And again, remembering those under 12 will represent a zero number. So filtering for race and ethnicity trends, we are asked this a lot, and this is for fully vaccinated folks in Allen County as of yesterday. You can see the categories on the left, and the middle column is the percent of vaccinations. And what that means is of the vaccinations given in Allen County, those are the percentages of those particular categories. And then on the right, that is what those categories represent in the overall population. So as of Friday, though, and I want to preface this, this is school age data that I pulled together. So I had to cobble together a little bit on the population data. The census data gives 19-year-olds included. The state's dashboard has 18s, and there's different age groups. So I did my best, but the point of this slide that I'm going to share is just to illustrate where we are with those that are in that childhood age. So these exact numbers don't have to be taken to the bank and shouldn't be, but they're close enough to make the point. So that the Census Bureau will estimate that in Allen County, what we have under the age of 18 is roughly 28% of our population and about 105,000. So those that are eligible, which again will be our 12 to 18-year-olds currently in that childhood category, is about 40,000, which leaves about 65,000 not even eligible yet. And then when we talk about who has been vaccinated of those who are eligible, 12 to 18, it's approximately 10,000. That's 1 in 4. That would then leave us about 90,000 of those childhood folks that still are unvaccinated. So we're going to have some work to do when the younger ones are eligible, and we still have work to do getting vaccinated those who are currently eligible. Now, this is a busy slide, but I'm going to guide you through the important parts here. What I have done is compared the cumulative vaccination doses, not individual people, doses administered over several months, so you can see some trends. And then the green is going to look at the cumulative amounts of fully vaccinated residents. And you can see they pretty much move at the same rate. The important thing here is to show what where we are now as compared to where we were when we started. So if we're looking at back in the early times when we were doing a lot of vaccinations, and you look at March to April, 81,000 vaccinations done, and that is by all of the vaccination sites in Allen County, 81,000 in a month, in less than that actually. Then we drop to 76,000 that next month. We then get to 33,000 when we're talking mid-June. To July, we did 13,000, and we've seen a slight uptick, which is good, getting us 16,000 in the last month. That's still a very low amount. And to do some damage for this variant and be able to move forward, we're going to need to keep these rates of both of these totals moving up a heck of a lot quicker. So we need to keep encouraging vaccination. Not only does it work, it is our ticket out. So when we're looking at this, again, the color code is similar. This is a zip code chart. We get asked a lot of this as well, who's vaccinated where. And this is a busy chart, but I'll hone in for folks. Again, you want to be blue. So the bluer you are, the higher the vaccination rate. And when we look at the Allen County area, and then those of you from surrounding counties can easily pick out hopefully your zip code. We have 20 zip codes now as of last week that are over 45% of their residents. We watch this very closely. I spend a lot of time on this weekly to see where we're at because I want to break it down further than what's on the websites. 3 of those have over 75%, and we have 1 zip code with over 91%. Pretty impressive, but still a lot of work to do. Even in Allen County, you can see we do have a couple of the darker shaded in orange areas, and we need to hone in on that. Now, this is too much for you to really read down, but in case on the left side, you want to look at your zip code or any of the zip codes that you know, I've tried to color code things. You'll want to then go over to the blue column, which would give you the percentage currently vaccinated of those eligible folks in those zip codes. I'll just give an extra 5 seconds for you to scan that for any zip codes of interest to you. And then I track on the side also the change per week. So we can see if we had a mobile clinic or if there was an outreach that say Parkview did or the state did or others, we can see did they help a couple weeks later? Are we seeing an increase in those zip codes? So we look at it to make decisions. And then I'll end a little bit with talking about some of the trends that we see that we want to share and advise a few things on. So what this slide is showing you is 5 months of 2 years worth of data. So our first case was on March 19th of 2020. And scanning forward to the August timeframe, we have 2 years full data of those 5 months. So the yellow is last year's cases, so the 2020 cases. You can see we started out, we headed on up, we stayed fairly steady throughout that whole year. Then scan back to the left of this slide where you see the orange, which picks up at the beginning of the year for 2021. And you can see we were in very, very high numbers. But as you see in the middle of that screen around the June timeframe, because masking was in place, people were being diligent on distancing and contact tracing, we saw single-digit cases and not many deaths, which I'll show you next. So where we saw that huge drop, things were getting a little bit more controlled. Then as you can see, as the mask mandate is lifted in Indiana, not only do the cases spike, but unfortunately, the deaths do as well. So when you look at this, very similar, just different colors, so bear with me. The blue shows you 2020 deaths. Each of those lines up to 4 and 5 deaths a day. We had quite a bit over this last year. Then again, if you're looking at where my arrow is pointing around that June timeframe, the orange is 2021 data, and any of the dots are specific dates. So dots on the horizontal, no cases or no deaths. The dots on the top points there are deaths each day. You can see we had a 25-day period where we only had 1 death prior to the mask mandate. Masking works, vaccines work, distancing works. Those are the things we know work. We need to get back to those, and I know that's going to be discussed. So what we implore upon you from these slides talking about our data is to support vaccination to the extent possible and know that those are the mitigation methods that are going to move us forward. So with that, I'll turn it back over.
Hi there, it's Dr. Mike Knipp with Parkview Occupational Health. What I want to do here for a couple minutes are 2 things. I wanted to continue on with the discussion from Dr. Sutter and Mindy here and discuss refresh, reboot, and reemphasize some of the NPIs or non-pharmacological interventions that have been in place since the beginning of the pandemic and are even more important right now. The other thing was to speak real briefly about the OSHA temporary standard that was just rendered very recently and its impact on employers. So next slide here. So what you'll see here is the adapted to a pandemic, the hierarchy of controls that's from the industrial hygiene literature. Real briefly, again, it begins at the top with the most effective strategy is elimination to remove that hazard from the workplace, an engineer control, which isolates workers from that hazard. Below that, administrative controls to change how people work. And at the very bottom, the term we're all very familiar with now, PPE or personal protective equipment, which gives the worker something to protect themselves with while they're in that work environment around that exposure. Next slide. Just again to refresh, many of you have probably been doing a lot of these methods for quite some time, but these are just some practical examples of how these NPIs translate over into the workplace. Elimination, of course, sick people would stay home. For example, in engineering control, you may again have seen at the grocery store or another store is a plexiglass barrier between you and that worker. Administrative controls, changing traffic patterns, the social distancing we've been doing. And then at the bottom to land slightly on PPE. So masks that I was just wearing, the surgical mask or the cloth one you've seen, those are not technically respirators. Those are things like N95s we're used to. But then again, the point's very important here with the source control and the masking that protects the environment from the wearer. So everyone in here is protected from me by this surgical mask. The N95s that healthcare workers and other industries are wearing, that's to protect that wearer from the environment. So a question at the bottom I've been asked several times is, where do vaccines fit into this hierarchy of controls? It's not a perfect fit classically, but I would put them as an intended elimination strategy, intending to not have people who can transmit or be infectious in the workplace. But of course, as Dr. Sutter and Mindy have discussed, the Delta variant has made this strategy a little bit more complicated. Next slide. So real briefly, the COVID-19 ETS. So for those not well-versed in the OSHA language, this is an emergency temporary standard. OSHA is in the Department of Labor, which issues legally enforceable standards for covered entities. Certain industries are used to these for exposures like lead, chromium, asbestos, things like that. This was entered into the Federal Register in June, became effective a month later in full. The intent, this was just with healthcare workers to protect them from a COVID-19 exposure. It contains at length specific work environment and scenarios in which you need to determine if their exposure is there and what do you do, and requiring employers to evaluate how to mitigate that exposure risk. At the bottom there, I do put a point there to say other industries could be added to this. End of June, there was a court filing by those organizations there with the opinion that this standard was too narrow and needs to be extended by OSHA to include other industries. So that could be coming and we'll be watching. Next slide. So what about other industries not under this ETS? OSHA did in June release some updated guidance. And again, just this past Friday, they updated it one more time to be more in line with the CDC guidance from 7/27, which to me brings it into the reality with the Delta variant. It has practical strategies to help those not under the standard comply and provide a safe as possible workplace for their workers. Because since the pandemic started and beforehand, employers have always been held to these, for example, these two standards, a PPE standard if it applies, and then every employer covered under OSHA, regardless of industry, this general duty clause with bolded to protect as well as possible workers from recognized hazards that could cause them death or serious harm, under which COVID is listed. With that, I'm going to turn over to Anna Belote, the safety director for Parkview, to just give a little bit of insight on navigating ETS compliant as an employer. Anna?
Good afternoon. So I wanted to share a little bit with you today about, as Dr. Nip was talking about, the OSHA ETS standards and what that means to you as an employer. So we've been navigating these waters for the past several months on how these standards apply to us as a healthcare entity. But I wanted to make sure I translated that out to those who maybe aren't in the healthcare industry, from manufacturing and automotive and other industries out there. So as Dr. Nip mentioned, OSHA 1910 is that general duty clause that really is a catch-all for all types of regulations from OSHA. So if you are a employer, you would need to make sure that you're adhering to these at some point. So wanted to share a little bit with you on what that would look like for you. So there's some really great guidance with the OSHA ETS from OSHA that they put forth, some great resources that you can tap into. Primary thing that you want to look at is how they would apply to you. So for those organizations that might have an occupational clinic, health clinic on site, if you have contractors coming in to do audiology screening or silica testing, those might apply to you as well. So as you're going through these ETS, make sure you're first identifying, do they apply to you? If they do, there's some things you really want to make sure you're focusing in on. And one of those is they want to make sure that you're really tapping into your frontline coworkers. So the boots on the ground people, as you're creating these policies and you're creating these, doing maybe a job hazard analyses, that you're including them in that conversation. So it's not leaders only doing these standards. So as you're doing that, making sure that you've got them included, you're having conversations. There's talk about physical distancing. How are you meeting that? What are you doing about screening your coworkers or other folks that are non-employees that come into your building? How are you handling that piece of it? What are we doing about return to work, or when somebody, a coworker or an employee is off work sick? How are we managing that from a pay structure as well as time off? So there's a lot of different elements to the OSHA ETS. And again, as it doesn't really, it hasn't really funneled out quite past the healthcare piece yet. But it will. As Dr. Nip said, it's just a matter of time. So if you have a chance and go to the OSHA website, osha.gov, look under the subpart U, and that is where that will show up. And it has, again, some really great resources for you to tap into on that. Thank you.
All right. Good afternoon, everyone. My name is Joe Cohen. I'm a partner or an attorney with Barrett McNagny, specializing in labor and employment law. And I just want to thank you for the opportunity to speak today in regards to COVID-19 and vaccines. It's something that we've been speaking on, I think, for about 18 months now, back in late March, early April of 2020, when we first began. Go ahead, next slide. I think the first question that I get, or that we deal with the most, you can skip the slides a couple here to get all the bullet points down. There should be 4 of them, one more. Perfect. Is on the vaccine mandate. That's the probably one of the most crucial questions that our employers are getting now, or really probably considering as we sit here today. And that is, should I do a vaccine mandate, and how will that affect my employees? We've also seen in the last few days contractors or subcontractors, especially in construction industries, that are being required by the people who hired them to only send vaccinated folks. So I think really where this is coming from most recently is what we just spoke about here a few minutes ago, and that's the OSHA recommendations that were published on Friday, the 13th, August 13th, where OSHA recommended that employers have vaccine mandates. And I think as a part of that, as well as the government's position in regards to governmental contracts have only vaccinated folks working, you have this a real push recently for vaccine mandates. So when we talk about ethical considerations, kind of taking a step back, that's the ethical consideration of you as the employer requiring your employees to become vaccinated. At the moment, the vaccines are only under an emergency use authorization. Doesn't have full authorization, not saying that it won't. And I think it probably, for most things I've read, and the doctors can speak on this much better than I can, will get full authorization or approval here shortly. But there was some concern, especially 6 to 9 months ago, about requiring your staff to get vaccines under that circumstance. But one thing that we can say is that from a legal perspective, it is perfectly appropriate to require or to have a vaccine mandate or require your employees to be vaccinated, except under 2 circumstances, okay? Or there's 2 exceptions to this general rule. The first exception is if there are employees that have what we call an underlying health condition or have a disability that would prevent them from becoming vaccinated. Maybe that could be allergic to something that's contained in the vaccine. You cannot force someone to become vaccinated in that situation. In that situation, you really would have an obligation to what we would call reasonably accommodating someone under the Americans with Disabilities Act, as opposed to requiring them to become vaccinated. The other exception to the rule of being able to mandate a vaccine to your employees would be those that have sincerely held religious beliefs. If they have a sincerely held religious belief that prohibits or does not allow for vaccinations, again, the employer would have an obligation to try to reasonably accommodate those sincerely held religious beliefs. Under both situations, that accommodation could be working remotely, whether that's from home, working in a place where they're not going to have any contact with other employees or any customers or anybody else. The options are endless based upon what you can come up with on your own or with your interactive process with your coworker. But at the end of the day, the vaccine mandate is perfectly legal as long as you have those two exceptions. And this was most recently confirmed if you read the newspapers late last week in the case of Klassen et al. Versus the trustees of Indiana University, something that was here locally or within the state, where the Indiana University has a vaccine mandate for all staff, professors, and students that are going to return to school in August. As someone who just returned their son to school yesterday, I can tell you firsthand of the vaccine mandate. But a group of students sued the university, sued the trustees, claiming that it was a violation of their constitutional rights of what they put in their body, if you will. And that was denied at the lower court. It's been denied in the Seventh Circuit Court of Appeals. And as you saw here recently, the United States Supreme Court denied or refused to hear the case, which makes the Seventh Circuit decision the law, if you will, in the Seventh Circuit, which then confirms what we've all been saying for the last 9 months or so, is that you can have vaccine mandates, that they are perfectly allowable as long as you have the two exceptions for reasonable accommodations for disabilities and reasonable accommodations for sincerely held religious beliefs. What was important regarding the Indiana University vaccine mandate is if you didn't want to become vaccinated, there was another option, and that was that you would be susceptible, or you would agree to voluntary testing, COVID testing, at least once, and in some cases, maybe twice a week. And because there was another option, that was the reasonable accommodation to someone who had a underlying health condition or a religious belief that prevented them from getting the vaccination. So if you go and you do decide to do a vaccine mandate, the question that we get next is, well, how do we show that someone's been vaccinated? Are we allowed to ask that person or ask an employee, have you been vaccinated? The answer is, generally speaking, yes, you can, especially if you have a vaccine mandate. The real concern is to what extent do you require that employee to prove to you that they've been vaccinated? And there's really 3 buckets that people fall into, and they're all legal. It just depends on how aggressive you as an employer want to be in enforcing your vaccine mandate. For example, the first option would be you ask your employee verbally or orally and ask them, have you been vaccinated? And if they say yes, that's fine. That's enough proof that they have satisfied the vaccine mandate. As we all were not born yesterday, and we can all understand that there's certainly the possibility that people could be less than truthful in regards to their response as to whether they've been vaccinated or not. So although that could satisfy a vaccine mandate, it probably isn't the most best way to make sure that everyone's been vaccinated. The other point on the vaccine mandate would be another way of doing it would be sign a certification, to have the employees sign a document that they had, kind of like an affidavit that would say, hey, I was vaccinated. I certify that I was vaccinated. And then that would be, now you have written documentation that they have been vaccinated and they satisfy the vaccine mandate that the employer may have created. That's a little bit better than just taking their word for it. It certainly isn't as restrictive as requiring documentation, which is the third bucket, or the third requirement, which is require actual proof of the vaccination. That's the card that you get when you get vaccinated, or the email that you would receive from the Department of Health saying that you've been fully vaccinated. All 3 are perfectly legitimate. All 3 are perfectly legal. It just depends as the employer which one you feel the most comfortable requiring your employees. For some situations as the employer, if you are requiring a mandate because someone else is requiring you, such as a subcontractor and a contractor relationship, you may want to talk to your contractor or the person who's requiring it to see what documentation they require before you go further. The next part of the vaccine mandate part is what if someone decides that they want to remain unvaccinated? So you don't have a vaccine mandate, or maybe you just strongly encourage individuals to be vaccinated, but you're not making it a mandate. What happens in those situations or what can you do as the employer with those employees who decide to remain unvaccinated? You'll notice, from Friday, the OSHA recommendation is that that you have a vaccine mandate. They also indicated that if you don't have a vaccine mandate, or you have individuals who are unvaccinated who will not become vaccinated, is that you require testing once or twice a week. The question is, can you as the employer do that? The short answer is yes, but currently it is not as clear cut as requiring them to be vaccinated, because you are requiring them to get have a medical examination, which is what the testing would require. But you can do that, and it would be a reasonable accommodation to the vaccine, or to them not getting vaccinated. The next obvious question would be, what if someone isn't vaccinated and then refuses to get tested? What do you do as an employer? In that situation, unfortunately, your next step could be, if you decide to do that, would be to terminate that employee's employment, because they are refusing to get vaccinated, which isn't required at your facility, but they're also refusing to get tested. So they're really refusing to do anything. And at that point, if you felt it necessary, felt it appropriate, you could terminate that employee at that point in time, because they're not following any of the guidelines that you set as the employer. So that's a brief synopsis of vaccine mandates and how they impact the employer-employee relationship. If you want to go on to the next slide, that's when we discuss confidentiality of COVID-19 testing. So say in the past, hopefully you've done it this way in the past, but if you decide to take the route of, well, we're only going to encourage employees to become vaccinated, we're not going to require them, we're not going to mandate them, but we are going to require them to get maybe tested once a week. Or someone comes into your facility with symptoms, you can go one more time. There you go. Perfect. Oh, there you go. And what happens in those situations when someone enters an employee has symptoms and gets tested and calls you up and says, I'm positive for COVID-19. What are your obligations? Well, you do have obligations as the employer to that employee who's tested positive under the Americans with Disabilities Act and confidentiality. A lot of folks come to the mistaken impression, unfortunately, that if someone has tested positive for COVID-19, that the appropriate response is to tell everybody in the office that Joe Cohen tested positive for COVID-19, and that's not appropriate from a Americans with Disabilities confidentiality standpoint. Now, I'm not saying that we don't want to do contact tracing. We absolutely need to do contact tracing, but there's an appropriate way from a legal standpoint to do contact tracing and still stay in line or compliant with the Americans with Disabilities Act. And that is that you tell only those who have a need to know the information that they need to know. If you have a 6-story building and you've been socially distanced, there is no reason in the same way Joe Cohen works on the 4th floor of the building and has never been on the 2nd floor, 3rd floor, or the 5th floor. There is no need to know that everyone on the other floors that I tested positive, because I have not had any exposure to any of those folks. So already we should be narrowing that circle of individuals who are advised of my positive testing. But if an email is sent to all the staff on all the floors, my confidentiality under the Americans with Disabilities Act has been violated. Again, there should be a small group of people who are going to be advised of my positive test. And then you would ask me, who is it that you had contact with within 6 feet for more than 15 minutes? And those are the people who are then advised of my positive test. From a legal perspective, when I go and talk to those folks, I won't even tell them who it was necessarily who tested positive. Again, I'm entitled to that confidentiality under the Americans with Disabilities Act. The message should simply be, you have been exposed to someone who has tested positive for COVID-19. That exposure was within 6 feet for more than 15 minutes. That was a high risk exposure, and therefore we need you to get tested and or quarantine. And depending on your symptoms, if you're asymptomatic, and I'll let the doctors take care of that at a later time and how the whole quarantine process works. But it's extremely important that we keep confidential information confidential and only distribute it on a need to know basis. Okay, next slide. There we go. Okay, now this is a blank slide because at the time this was on Friday, and the OSHA recommendations were just published. So what I want to do here is kind of discuss a couple of general recommendations from OSHA from the Friday, August 13th, 2020 recommendations, as well as some other ideas that I've seen and recommended to different businesses and employers. First, in regards to vaccines, we have vaccine mandates. We've talked about that already significantly. We've talked about testing and getting people tested instead of the vaccines, our mandate. Another option is vaccine incentives, and that is to incentivize your employees to get vaccinated. That is within reason, legal as well. And when I say incentives, that would be anything from additional PTO time. If you get vaccinated, we'll add 1, 2, 3 days to your paid time off bucket or your vacation bucket. Maybe it'll be an additional $100. It could be a gift certificate. It could be cash to incentivize your employees to get vaccinated. And as opposed to having a mandate where they're required to, or requiring them to get tested once or twice a week because they don't want to get vaccinated, to give them some other reason and incentive, on the words, to get vaccinated. That is perfectly legal as long as we're talking about a de minimis amount of the incentive. You can't start paying people thousands of dollars. In that situation, you get crossways with the Equal Employment Opportunity Commission. And I'll spare everybody getting into the weeds on that. But at the end of the day, one strong possibility is you have vaccine incentives, something upwards of $100. That was what it was back in January, February. I think we're getting to the point now where we've seen companies offer more than $100, closer to $250 to $500. But you need to keep that number somewhat de minimis, or like I said, you can get sideways with the EEOC. So to kind of talk again real briefly about the OSHA recommendations, or to get into a little more specifics, we talked, it was a couple slides ago about what was in those recommendations. And I want to emphasize the fact that they are only recommendations. It's not the law. Okay, what OSHA published on Friday, August 13th was not the same as the ETS that we discussed. The ETS is law, and if you're a healthcare worker or a healthcare employer and you fall into those categories of the ETS, you have to follow that or you're violating the law. As we sit here today, the OSHA recommendations that were passed on Friday, August 13th, 2020, technically is not the law yet. Okay, it's just their recommendations. And I'll get into a little bit here briefly about what we referred to earlier as the general duties clause under OSHA and how that impacts these recommendations. But the OSHA themselves acknowledges that this recommendation back on Friday were advisory in nature, okay? Now, that doesn't mean that we ignore it because it's advisory, okay? But it does mean that we should probably consider it, and based upon where we are in the community, the type of facility we are, the amount of employees we have, the ability to socially distance, the abilities to wear masks, the CDC guidance and how that's changing may impact the decisions that we make moving forward. I certainly understand and can appreciate, and I agree that we may be just on the cusp of a lot more recommendations, and maybe not recommendations, but regulations when it comes to OSHA, CDC, and other organizations. But as I indicated earlier, OSHA have adopted the position that employers should mandate a vaccine or have weekly testing, okay? So it's not required by law, but that's what their recommendation is, and is their recommendations, which is the same as the CDC guidance, okay? They also make two additional recommendations, and that is mask wearing in buildings, which is again, comparable or consistent with the CDC guidelines, as well as social distancing, which again is consistent with the CDC guidelines or CDC recommendations. They have not required it, but it's their recommendation, okay? They also are encouraging employers to provide paid time off to employees who miss time because of COVID-19 reasons. That was one of the questions that was forwarded to me earlier, and I think we just real briefly discuss it. I think we're ahead of time a little bit, and that is, should we require employees to take PTO for COVID-19 absences? And is there another way of paying them time off if they have a COVID-19 absence? One, can you require them to take PTO? Yes, you could. But I think if you look at the CDC guidelines, you look at OSHA's position in regards to PTO, nowhere does it say that the employer is required. They're not requiring you to do that, but they're certainly encouraging you to give them time to do it, not to require them to use their own PTO. So I think if you require them to use their own PTO, at some point, OSHA may not take too kindly with that. I believe so the option would be to tell the employee, you have the ability to use your PTO if you want to. You don't have to, but it'll be unpaid time off. Now, remember, OSHA is encouraging all of us, all the employers, to give them the time off without using PTO or their yearly allotment of PTO, to give them additional time. Please make sure you understand that this is the OSHA recommendations from Friday. If you're a healthcare facility and fall under the ETS that took effect in July, you are required to pay them for their PTO. You are required to pay them for time off from COVID-19, from testing or from side effects of testing and from issues with COVID-19. So I guess at the end of the day, what I'm saying is, if you're a non-healthcare facility, I would not require your employees to use their PTO. I would certainly offer it to them, but I would strongly consider just saying, hey, if you need time off for COVID-19 to get tested, or you need time off for COVID-19 because of a side effect from the vaccination, we're gonna make that paid time off, and we're not going to count it against your allotment from your bucket, as opposed to requiring them to take paid time off. The last point I would make is that you can always opt in to the American Rescue Plan Act of 2021, which does provide each employer a tax credit to their wage taxes or salary tax. So if I would pay my employees to take time off for COVID, that time that I pay them I would get a dollar for dollar tax break on my income tax, if you will, or as an employer. Something to consider. I know we're getting long on time, so I'll let you be, and certainly welcome to answer any and all questions. So thank you.
Thanks for that, Joe, and all of our other speakers. We're gonna transition now to the question and answer portion of the webinar. The Q&A tab down at the bottom of your screen is active, so you can submit questions there. We've got several that were submitted ahead of time that we're going to be walking through here first. So we'll just we'll jump to the first question here. How can we encourage our employees to get vaccinated? And I'll let one of our speakers take that. Anybody want to touch on that? I know we've got the answers there. Mindy, do you want to add anything to it?
So we definitely want, as you can see, to make information available, make sure that everybody has the facts and they know about the safety of the vaccine. Absolutely allowed pay time off to get the vaccine. We've got on-site vaccine. We have our own clinic here at Parkview that we've had since December. But we also have on-site vaccine clinics with the number there if you want to call that. And then you can also consider incentives to motivate. We have not done that quite yet at Parkview, but we are looking into everything right now.
I know the next question, can we go and go to that? I know, Joe, you kind of touched on this in your section. Legally, can we mandate vaccines for our employees? How are they allowed religious or medical exemptions? I know you went through that generally you can mandate that, and some of the traps in that, I guess, or some of the challenges in that. Anything you'd like to add to that?
No, it's one of the reasons why I went over, because it's one of those questions that it's hard to put down the entire answer in a little slide. I just think that it's each employer is different. You know your employees better than anybody else does. Not only are there the legal challenges that we discussed, but there is just the day-to-day challenges of your employees. There may be some employees who are going to say, I would rather not have a job at this facility than to get mandated to take the vaccine. It may not be right. We may not all agree with that approach, but there's going to be people who will have that approach. So that's something, there's a lot of different considerations, not just the legal considerations that you really should take into account.
Thanks, Joe. We're gonna jump to one of the online questions that we just got from Martin. And Dr. Nip, I think you want to take this. Is it recommended for businesses to have employee check-ins and process as far as staying home, things like that? Can you maybe talk a little bit about his questions?
Sure. Hi, it's Dr. Nip. So I think this is a good idea to have some sort of standard system that applies to everybody from CEO down to first day on the job person. Of course, we don't want to get into ADA territory where it could be seen as discriminatory. What should that comprise? Again, each employer is going to need to look at their bandwidth and logistics, because if you document data, you need to track and protect that data. Many employers I have seen have done kind of an honor system self-screening. I know our legal colleague mentioned that honor system may just need to be there, but if you can encourage, creating an environment where we don't want people who feel ill to come to work, and then you engineer in making that a reality so there won't be retaliation perceived or real. I've seen other things come out from NIOSH and other industry guidance of potentially suspending attendance bonuses so you don't have people coming into work ill. But I do think it's a good idea to, as best as you can, implement something that could, again, work at that elimination strategy if you don't have ill people at work, and just educate them on what to look for and however, what works with you as an employer regarding logistics and bandwidth.
Joe, we've got a tax credit question here for you. Would we be eligible for tax credits for paid PTO for COVID if we have more than 500 employees? Oh, you're muted, Joe.
That's a very good question. No, it's going to you have to be less than 500. That is the line in the sand, I believe. It used to be, was 300 maybe earlier last year when they had other things, but 500 is that line in the sand. So if you're over 500, that is not going to, you're not going to be eligible for that. If you're under 500, you will be eligible if you opt in. And opting in gets you the tax credit. But just to be quite honest and blunt, there's a lot of other strings attached to that tax credit that you have to agree to. Not saying that that's bad, but you need make sure you understand what you're all opting into. It's not necessarily, it's more of a buffet opting in as opposed to a la carte, if that makes sense. So.
Here's another legal question for you. Can we mandate vaccine? Sorry, are we allowed to ask our employees their vaccination status? And do they have to provide a validation of their response?
I'll go ahead. I assume I'm up for that one as well.
Yeah, I think so.
Yeah, it's an excellent question. One, since you have since vaccine mandates are enforceable, other than the exceptions we've already discussed, you certainly can ask your employees their vaccination status in that regard, in the terms of a vaccine mandate. What I would not recommend, though, is you simply walking around and talking to people in the break room, say, hey, are you vaccinated? Hey, are you vaccinated? Are you vaccinated? You really need to have a purpose for it. If someone's been exposed, I think in those situations, you may ask them if they've been vaccinated. And so I think you have to have a legitimate business purpose of asking that question. And then it goes on to the next question or the next point that, John was just reiterating a few moments ago, and that is the three buckets as to what information or what the validation is to their response. Is it just trusting them orally? Probably not very effective, but it's possible. Having them sign a certification, which is a little bit better, or actually requiring them to provide documentation of the vaccination, which is your best approach. But that's the one you're probably going to get the most pushback potentially from employees who want to keep sometimes they want to keep that private. One thing I've said to some clients when it comes to vaccine mandates or vaccinations is just ask them whether they have been, if they don't want to disclose it, just say, are you vaccinated or would you rather not disclose? And if they say, I'd rather not disclose, that doesn't really tell you whether they are or not, but they don't have to disclose it to you at least. So they're not going to feel that they have, you violated their personal freedoms, if you will. But they're going to go on the unvaccinated list, regardless of whether they're vaccinated or not. It just is, again, trying to balance what some folks feel is their personal freedoms, which we have to respect at least, or acknowledge, to what is best for the public in regards to the vaccination and keeping people healthy. And it can be a tough balancing act sometimes.
All right, we're going to jump to the next slide. If people have already taken the step to get vaccinated, do they need to use other precautions like masking and social distancing? Why or why not?
Dr. Sutter, you want to take that one?
Sure, I can. So in general, what we saw from CDC was after you were fully vaccinated, you did not have to take standard precautions. And that was based on data that we had from earlier variants that vaccinated people were much less likely to get infected with COVID-19 and much less likely to transmit. That all changed several weeks ago, and it was based on a small data set coming from Massachusetts with a series of outbreaks after the 4th of July weekend. Those aren't definitive, but they just raised a red flag to say, what we previously saw, that vaccinated people are really safe and probably can't spread, may no longer be the case. We don't really know how effectively vaccinated people spread if they get infected, but since it's in doubt, the safest thing is to move back to vaccinate or to masking and socially distance in areas that have significant community spread. So the CDC defines that as substantial or high. And almost every county now in Indiana is in substantial or high spread, and Allen County is in high spread, as is most of the rest of the state. So whenever there's a lot of it going around in the community, then vaccinated people need to start taking similar precautions to unvaccinated. When the community rates go down, assuming they'll go down later in the year, that may be able to go away.
Joe, I'm going to follow up a little bit. If the employer does not require vaccines and does not have a mask mandate, can an employee ask for accommodations like work from home to protect their health?
The question is, can the employee ask for that or the employer? I mean, either way.
Can the employee ask for an accommodation?
Yeah, if they could certainly ask for it. Now, whether they're going to get and be entitled to it, it can be somewhat of a different story. If I have an underlying health condition, I have a religious, sincerely held religious belief, absolutely, I can certainly say, listen, I have an underlying health condition, I have a disability that prevents me from getting vaccinated. Can I, instead of getting tested every week, or maybe I'm not even getting tested every week, that's not an option, can I work from home? Absolutely, they can ask for that, and I think it's the employer, the employer I know will have an obligation to at least have a conversation with that employee to see if they can make it work. Not every position is going to be amenable to working from home. I've had cases here in the last year where we have situations where we had receptionists, the front door receptionist who says, I want to work from home. Well, that's, I understand their desire to work from home, but if you are a receptionist, that's your primary duty is to greet people, and you can't greet people if you're working from home. So it's a case-by-case basis, but I think it's something that the employee should certainly can ask for, especially in those situations, and the employer is going to want to have those discussions to see if there's a way to make it work.
All right, we're going to ask another testing question. If employees opt to remain unvaccinated, is it a safe option to require them to be tested for COVID-19 weekly? Or one of the online questions is, can we legally require regular testing of unvaccinated employees?
Well, from a legal perspective, you can ask them to be tested. Okay, it's all going to depend on if you're not doing. it all depends on the premise. And I know this gets confusing on a short little seminar, but if you are not doing a vaccine mandate and all you're requesting is that everybody get tested once a week, if you're doing it to everybody, treating everyone equal, I think that's very doable. If your position is we're going to do a vaccine mandate and those who don't want to get mandated or not, I'm sorry, we're going to encourage everyone to be vaccinated. Those who aren't vaccinated, we're going to require them to get tested every week. Can you do that? Yes. Is it as clean as I'd like? No, because there could be this argument that the only people who are getting tested every week are those with disabilities and those with religious exceptions. And now it looks like you have a policy that has a disparate impact on a protected class. Now we're going to start getting into the weeds, but that's kind of where that challenge starts to present itself. But the short answer is yes, you can do testing and require your employees to get tested every week, especially as a reasonable accommodation. But you're going to have to kind of take it on a case-by-case basis. That makes sense.
Dr. Nip, do you want to add in on this?
Thanks. Not from a legal perspective, but just from an occupational medicine surveillance perspective, that we want to take a proactive stance and we're trying to surveil and pick up things from a secondary prevention standpoint before symptoms show up. Same strategy has been applied for years to things like lead or other substances. We biologically monitor people to see is there evidence of exposure or from that exposure. We aren't all the NFL or Hollywood, so we don't have the resources to create bubbles that you may have been hearing about in the news, but that's what they have been taking a stand, the sports teams and some of the TV shows and movies, the proactive weekly, everybody who's going to come on set gets a test. And I think that is why it's been done, because it hits those legal boxes of everybody is treated the same, but there's a reason that it's the approach, it's legally tenable. Plus it's a core surveillance strategy in the OCMED world to just proactively do things before before the wheels start coming off. You're doing the regular maintenance, taking a look at things. So that's just the OCMED perspective, legally well said by our legal colleague.
And real quick, John, if I may jump in, one last comment. And one thing to keep in mind, the question is asking if we can test them weekly. No matter what, don't confuse what I'm saying. I know the panelists aren't, but is that if someone has symptoms, the employer can say, go get tested, and they should get tested, because that goes back to trying to help with the spread. So don't get confused that. I want to make sure I'm clear that, you still have, if someone walks in, an employee, and they have any of the symptoms that, the doctors have discussed, and we've seen around, please get them. They should be told to get tested immediately and go through the whole quarantine process and contact tracing. So
one of the questions online was if we mandate testing, does the employer need to pay for that, or is there any tie with that on paying for testing?
Well, if you are the employer and you are requesting and requiring them to get tested, you should be paying for the test. Now, to be quite honest with you, I haven't had to get tested in a while, but I still think they're free. I don't know if there's even I guess there is the shots are free. The testing may have a cost to it. You don't have to, though. There isn't anything that says that requires the employer to pay for it by any means. Especially if someone's been exposed or may have the symptoms from going to restaurants or going out to parties or whatnot. So in situations like that, I should say the employer has no obligation to ever pay for the testing themselves or to their employees. Now, if there is a concern that employee may have been exposed and tested positive, or maybe has symptoms because of something that happened at the office that you can prove or show, that may want to change your philosophy on whether you want to pay for that test or not as the employer.
Okay, if we have in-person meetings or events planned based on the guidelines that are coming out, should we be looking at doing anything differently? Dr. Sutter, Mindy, maybe that's a question for you all.
I'll take the first part of that, and I think Parkview would like to comment on what they've done to kind of set some examples there. So those large face-to-face events where we all got sort of back to doing that over the last couple months, we do ask that you consider following the CDC guidance on that currently, which, as when we started to see the spikes in cases and so forth, they reiterated some things. They're very similar to what they were before. The link is provided on the slide, but you can easily find it on the CDC site by just Googling that topic. But they will discuss distancing, masking while indoors, and being diligent about it. All of the same practices that we know that work. But I know there's questions out there whether we should be considering moving back to virtual things or, those sorts of topics. And it's that time, I think, to consider that what's safe for the community, what's safe for your employees or your attendees. Because I would think, on the other hand, if you have these larger events and then you have an exposure or a case, there's a lot that goes into notifying those people, and the risk was taken at that facility. So just consider following those guidance steps that they list. They have a lot of different types of events broken down for your assistance. And I think Parkview would like to comment a little bit as well as what they're doing.
Yes, thank you. So Parkview definitely has taken all of this into consideration, and we've made the decision. We're pausing on any planned events that are that would be held at Muro. We moved the tapestry event to next April. We know, given the business that we're in, that we want to be good role models out in the community. So we are also really asking our coworkers, if they're representing Parkview, to make sure that it's a remote meeting. We are pausing on any non-urgent meetings, and we've moved basically everything to virtual meetings when possible. Again, we just want to be role models out there. We want our community to be safe, and so we are trying to be as safe as we can here at Parkview.
One of the big questions out there is quarantine and isolation. I know it's one that I've had questions about keeping up on with folks. Can somebody walk us through the isolation guidelines?
Yes, I'll take the next two slides. We're going to walk a little bit through the isolation guidelines and then the quarantine guidelines. Some slight nuances since we initially talked about this last year. And at the end, you'll see a couple QR codes where you could easily grab the FAQs on this from our website to make that easy for you. Sometimes it's hard to talk through algorithms, so we wanted to make sure you had another option. But isolation, just a reminder, that's what happens when folks are, when they test positive. We want to keep them away from others. And then quarantine is what happens to those who are exposed, so we can ensure that they are also separated for a longer period of time to ensure they don't go on to develop the disease. But for isolation, and we'll just speak in kind of like a first person terms here. So if I test positive for COVID-19, and this does not matter whether you're vaccinated or not, positive is positive for this. So if I test positive, but I have no symptoms and I don't go on to develop symptoms, I still need to isolate just like I would at any time. And that would be for 10 days from my test date because I have no symptoms. So I'm positive, I did test positive. That is the start of my isolation period. And then I can be around others on day 11 if I no longer have a fever, even if actually that was asymptomatic. So that would just be on day 11 as long as you have stayed symptom free. Then as far as the ones that test positive and do have symptoms, you'll isolate for 10 days from the start of your symptoms and can be around others on day 11 if you are fever free for 24 hours without the use of fever reducing meds and your symptoms are improving. And we all know that sometimes some symptoms are going to linger, but we do need to see symptom improvement and no new symptoms occurring. And then you can release after your 10th day in isolation. Next slide. And then those, again, for quarantine, those are exposures to a positive case. So if I'm a close contact to someone who has tested positive and I am unvaccinated, the top orange box, I must quarantine for 14 days from the last date of contact I had with that positive case. And then I can be around others, and they have come up with in the last few months, we have what we would kind of refer to as early release options, and they have to do with testing. So you're in quarantine for those 14 days. Unvaccinated. If you are wanting to discuss getting out of quarantine early, that would be for testing out early. And on day 8, if you have a negative test on day 5, 6, or 7, or you have a negative rapid test on the actual day 8, you can leave quarantine early. If you are fully vaccinated but develop symptoms, so you're exposed to somebody who is a case, but you are fully vaccinated, if you develop symptoms, you would be treated just like anyone else, where you would need to isolate from others and seek testing. Let's see if you actually do have COVID. So if you are positive, then you would isolate for that entire 10 days from when your symptoms started. And then you can be around others again on that day 11. If you're fever free and 24 hours, same thing, no fever reducing meds and the symptoms are improving. However, if you are vaccinated and you're an exposure to a case, but you have no symptoms, this is the time when vaccination really pays off for you. You don't have to quarantine as long as you stay asymptomatic. It is recommended, though, by the CDC that in that case, even though you're vaccinated, to wear a mask, because as Dr. Sutter and the others said, there is the potential that you could contract the disease, but maybe not show symptoms and still spread that. So they ask that you wear that through that 14-day quarantine, but you don't have to stay home. If you test on day 3 to 5 after that exposure and you test negative, you can discontinue that extra cautious mask wearing if you like. However, we consider it really proactive to consider still wearing that. So on the last scenario in the bottom orange box, if I'm a close contact to a positive person and I've tested positive in the prior 90 days, like I've already had COVID, but then I'm re-exposed, you don't have to quarantine as long as you stay asymptomatic. If you do develop symptoms, though, we would say isolate from others, possibly see your doctor or a medical professional where they may recommend testing such as rapid testing, because that should still pick up what you're seeing at the time. So it kind of depends on your situation, but those are the general algorithms we're working with currently for quarantine and isolation. And again, you'll see our FAQs shortly.
We haven't talked as much about contact tracing. Do we need to be contact trace individuals who may have been exposed to a COVID positive person through our business?
And I'll go ahead and tackle that. And then if Dr. Sutter wants to add anything, we do ask that if you identify or someone comes to you and says, hey, I've tested positive, that you consider doing what you've done for this last year and a half, which is contact trace internally with your own staff. Reason being is we will still do that as well once we get that case sent to us, which the problem is it could be a little bit of a delay due to testing when those come through, and we're seeing an abundance of cases, so we are having to prioritize. You could get things in place quicker by contact tracing and find out who was exposed, getting them quarantined, separated, doing the right thing earlier to interrupt that spread until we get a call out to your business or to those contacts.
I would just add to that. I mean, this is just an important piece. So we've got a number of tools to help decrease the spread in the community. And the first is vaccinations. The second is masking and social distancing. But then this is the next one, which is trying to stop those second and third order cases, so that when we have a case and potential contact, it doesn't keep spreading and rippling further and further out and growing at a rapid rate. So this is an important thing for people to cooperate with. And I really urge employers to help with this for the community in general, and also for your own business operations, to try and keep those second and third level cases from occurring.
What types of illnesses and hospitalizations are we seeing now? Long-term effects of COVID-19. And I know we've got a question online I'll add in here. What can you talk about the statistics in Indiana or by county, people testing positive for COVID that have already been vaccinated?
Hello, this is Dr. Jeff Board. I'm the Chief Quality and Safety Officer here at Parkview Health. So over the last 30-day period, when we look at all of our hospitals combined, our daily census of COVID positive patients has increased over 4-fold. So we have seen a dramatic increase in cases with the Delta variant corresponding with the surge in positive tests that Dr. Sutter mentioned earlier. When you look statewide, you see the same effect. Statewide hospital census has increased over 3 times over the same period. It's not perfectly homogeneous across all counties, but we clearly are seeing a very rapid rise in acute care hospital admissions in our health system. When we talk to our colleagues at Lutheran Health Network, they're seeing the same thing. IU Health is seeing the same thing in Community Health Network, Beacon, Eskenazi, Ascension St. Vincent's, all the major health systems are seeing similar rapid increases in new cases and new hospital admissions. The percentage of patients that present to our emergency department who are presenting because of COVID-19 has also greatly increased, which tells us something about that there is a widespread community transmission, and the people that are getting sick are then coming to the emergency department. So we are definitely seeing a surge here in Indiana, and it is accelerating. Regarding long-term effects of COVID-19, this is something that, from a clinical standpoint, we still have a great deal to learn. There was actually a New England Journal of Medicine perspective article that came out just this week, and it's estimated, depending on which study you read, that anywhere from 10 to 30% of persons who had COVID-19 illness continue to experience some persistent debilitating symptoms months later, and that's what has now been dubbed long COVID. And I want to just share a quote from that perspective article. So they estimate, factoring in new infections of unvaccinated people, the authors said, we can conservatively expect more than 15 million cases of long COVID resulting from this pandemic. And though data are still emerging, the average age of patients with long COVID is about 40, which means that the majority are in their prime working years. Given these demographics, long COVID is likely to cast a long shadow on our health system and economic recovery. And the title of the article, Confronting Our Next National Health Disaster, Long Haul COVID. So I think there is a great deal of concern among clinicians and public health and occupational health experts of the burden of long COVID is going to have on individuals, on communities, on industries, and our economy at large.
Can anybody touch on the vaccinated positivity rate or that aspect of it, or vaccinated hospitalizations?
Yeah, I don't have firm numbers on that, but we've known from the beginning that there are so-called breakthrough cases with the vaccines. So even with the earlier variants, we would see people who would still become infected with COVID-19. Those in general tend to be mild illness, and that's mild in a medical way, which means you may still feel really bad. Many people describe it as a bad influenza thing with body aches, high fevers, fatigue. That's still considered mild illness if you don't get the second part at about 7 days, where your oxygen levels get low and the respiratory distress that comes with that. That's what we're really trying to avoid. And that's what the vaccines continue to be very effective at avoiding. Having said that, there are some vaccinated people who have been hospitalized, but they are by far the minority. The vast majority of people being admitted are unvaccinated, and the vast majority of the deaths remain unvaccinated. So while it's still possible to get, again, the analogy I've been using is it's like wearing a seatbelt. Wearing a seatbelt does not give you absolute protection from dying in a car crash, but it does give you significant protection. And if you're in a car crash, you'll want to wear your seatbelt.
Add to that nationally, 97% of hospitalizations in the US are unvaccinated adults.
Okay, we'll be moving on. Should we require masks be worn in our businesses? If yes, until when? What are the community indicators that help us understand what precautions should be in place in our locations?
So I can handle the CDC guidance on that, and then maybe Joe can weigh in on the likely require masking. So I mean, CDC's got guidance on this, which is if you're in an area of significant or high spread, then there should be indoor masking regardless of vaccination status. So once our case levels go down, and they'd have to go down quite a bit, then I think we can return to the earlier guidance, which says if you're vaccinated, you don't have to wear a mask. If you've got an area where there's very little spread going on, vaccines still provide protection, and it makes sense that if you're not vaccinated, you wouldn't have to wear a mask. However, once you get into the very high areas, that changes the equation. And from a medical standpoint, I think it makes sense to require masks indoors as the CDC is recommending.
I'll go ahead and jump in, I guess, in regards to the legal aspects of that. And as I'm sure Dr. Sutter knows, sometimes the legal side of it doesn't always correspond to the medical side. And I get that completely. So at the moment, there is no governor's order requiring masks. The CDC has recommended that they wear masks. So at the moment, you don't have to require a mask as a business. However, as a business, you could still mandate masks, follow the guidance by the CDC, and you will be fined. There would not be any legal challenges to that or be deemed to be against the law. Like I said, you could require masking if you have employees that don't want to do it, and there isn't a health reason or that would prevent them from wearing a mask. You could discipline up to and including termination of that employee. One thing to keep in mind, to take Dr. Sutter's opinion one step further, is that OSHA does believe that you should be masking, and so if you could end up with employees who say, I don't feel that this is a very safe environment at this place, at my place of business, because we're not following any of the requests or the recommendations of OSHA and the CDC. I don't know what would happen in that situation yet. I've been involved in some last year where you have a disgruntled employee who may file a charge or a complaint with OSHA, claiming that their workforce is not safe because of certain steps that are or not being taken by the employer. I think as we sit right now, those things are kind of ripe until OSHA takes a firm stance one way or the other. But at the end of the day, a mask mandate is certainly not going to be viewed as against the law.
Dr. Nip, did you want to add a comment on long COVID while we're here at this point?
Thanks. Sure. I just had one additional comment. So the American College of Occ and Environmental Medicine, or ACOM, my specialty college, has been wrestling with this long COVID issue since at least about June 2020, because as you saw in Dr. Board, that quote, it's very sobering. It's hitting the working age population very strongly, unfortunately and tragically. So many of these folks, previously healthy, even have had a real extended struggle returning to any work sometimes, or to feeling at firing on all cylinders at their position. But I do want to let everyone know here on the call, the NIH just this past spring initiated a very large research initiative. There are clinics across the country that are specifically trying to assist and help these patients navigate their long haul or long COVID. And in fact, there's one right here at Parkview that opened in April. I've been able to be blessed to work with Drs. Chang and David on getting it up and running and trying to at least hear the stories and help the patients with their challenges. And I would encourage employers with folks in that situation to reach out, have them reach out to their treating doctor, or at least consider looking up the post-COVID things that are available, as even if we can't return to complete work, to try to get some sort of return to work path, because as we know, there's mental and emotional benefits to doing that. So just wanted to add that it is being looked at closely, and there are some resources available if any employers on the call themselves, or they have coworkers who are struggling with that challenge.
One of the things I think we've all struggled with is trusted data going through this process. Can somebody talk about the trusted source for data at the local, state, and national levels?
Sure, I'll start with that. So we have a couple websites of information that we do try to keep updated, and then we link to other trusted sites. So locally on our website is our main page, and then if you can't copy the link at the top, you'll see a tab that says Get Informed, and when you click that drop down, you'll see COVID-19. And there's a lot of resources there, as well as we keep a separate page. We call it It's Worth a Shot. It's all about vaccinations, information that we have, and then what we link to on other trusted sites. And then as you'll see, the Parkview Business Connect has a lot of information on their site as well. At the state level, when Dr. Shutter showed you some of the dashboards, there are several dashboards, whether it's for schools, long-term cares, general COVID testing, vaccinations. There are a number of them, and they all link to each other. So by going to that site, you can get to all those, and there's enormous amount of data. Some of the questions that are being asked in the Q&A, you can get some of that data at state and zip code level, Allen County, otherwise local level data there. And then nationally, CDC is who we generally follow for all recommendations. They are the experts in this field.
Dr. Sutter, we're getting ready to wrap up. Obviously, we've had a lot of questions today. I'm sorry we couldn't get to them all. Department of Health has some great documents out there on frequently asked questions. You can screen capture this, and it'll take you to some of those documents. Dr. Sutter, I'll let you take a minute to give me last minute thoughts on what you would like to see happen in the community and the direction you think we're headed.
Thanks, John. Well, I mean, I just want to say that we didn't expect to be here at the end of the summer, and we are. So, I sympathize. There's so much anxiety right now. Everybody would like to know exactly what to do for the fall. Everybody would like to know exactly what to do for next week. And some of the things I don't know that we have great answers for, but we're trying to provide the best answers we can, the best way to keep our community safe, to keep our employees safe, to keep our clients safe. The reality is there's more than 600,000 dead of COVID-19, and there's a tremendous amount of misinformation out there. The good news is we have some new tools. The vaccinations are still safe and effective. They're not perfect, but boy, I feel so much better going into this fall knowing we have those than without knowing that. We continue learning more about this virus all the time, and I continue to think that masks will be an effective way, and the combination of vaccines and masks will hopefully keep us from getting into shutdowns again, which are probably the most expensive way to stop the spread of this. So if we can find less expensive ways to mitigate this, to get through this, to not overwhelm our healthcare systems, to not overwhelm our healthcare workers, I really think we need to pull together as a community once again. I know we're all tired of this. It feels like we did this and we pulled together, but the fire's starting to burn again. So the more you can do to keep our community safe and all of us safe, I would strongly recommend that.
Well, I want to thank everybody for joining us today. Thanks again to our presenters and our partners at the Allen County Department of Health, Parkview Health, Barrett McNagny, and the team here at Greater Fort Wayne, Inc. As a reminder, you will be receiving an email with a survey of the event, as well as a link to the slides and a recording of the webinar. Thank you and have a safe day.